Welcome back to Advancing Healthcare Through Simulation. I'm your host, Lisa George, and today I'm pleased to welcome our guest, Dr. Sharla King, Professor at Faculty of Education at the University of Alberta. She's the Program Director for the Master of Health Sciences Education Program, a graduate program for health professionals seeking to enhance their scholarship in teaching and learning. Dr. King has worked in the area of interprofessional education and research at the university for over 20 years. She's a former board chair of the Canadian Interprofessional Health Collaborative and previously co-chaired 2 collaborating across-border conferences. Her research interests include interprofessional education and collaborative practice in pre-licensure and continuing education, blended and online learning, and educator identity development. All right, so to start off, I'd like to go back to the beginning of your journey and what initially drew you into interprofessional education and collaborative practice. So how did you first find your way into this space?
Sure. I just sort of happened upon it. I was finishing my PhD at the University of Alberta, and I needed a break before I started my postdoc. And one of the professors suggested to me that, hey, there's this position to coordinate a course. It's interdisciplinary or interprofessional course, and maybe you would be interested in doing that. And I didn't know anything about interprofessional education or collaborative practice, but I, applied to the position, and I was there for 20 years. Not in the same role, but in that field. And I mean, once I got in there, it really made sense to me that we should be bringing our health professional students together to learn together. And of course, as you know, the people in the field are so generous and so wonderful that, it was like family right away. So it was really enjoyable.
Absolutely. I feel like that is most people's experience of like coming across it and then just loving it and digging into that. So you've contributed quite a bit to IPE and multiple leadership roles between your role at the University of Alberta, but also the Canadian Interprofessional Health Collaborative as a co-chair, and then initiatives like Save STAN Simulation, which is an Edmonton-based interinstitutional experience for learners. So over time, how did your approach to designing and leading effective interprofessional learning activities evolve?
Oh, that's a really good question. I think for me, it was, like I say, when I first started, I had the opportunity to work with a really good team of people from across the health professions at the University of Alberta. So that's really where it first started. And they were more experienced in IP education than I was. So I did a lot of listening, and I, really tried to understand more about the field. And then having that opportunity to work with people like you and others at the other post-secondaries here in Edmonton, again, I just you surround yourself with smart people who have a passion for the field, and you just try to learn from them as much as you can. And you're also generous with what information you might have or what you might know, and it just becomes this kind of a community of practice. And I think, I don't know, I guess I didn't really think of myself as a real leader at all. It was just more that desire and passion and conviction, I think, that our students needed to have this in their educational programs. It needed to be in their curriculum. And we had to, work as hard as we could to get our students together to make this happen. So yeah, I think it's just being a growing conviction that this is a way to educate our students.
Yeah. And I think it sounds to me like you were really embodying those competencies while immersing yourself in the field. So really learning in real time. And, I can immediately think of quite a few opportunities where you led in the field and the numerous resources you and your team developed to help support those learning activities, whether it's in the, campus setting or moving into the clinical setting. So I know many of my colleagues in IPE use them to this day.
Well, like I say, it's been a great community to work with because I know there's a lot of information that we use and shared across the institutions. So it didn't matter what type of post-secondary people were at. Um, we were all sharing our resources. So that was, that was a really great time in my career. And I have developed a lot of friendships like you, for example, that I still have to today. So,
Mhm. And I know there's always challenges with IPE. I think if anyone has done any kind of leading in IPE, they know scheduling is a challenge. But
sure.
beyond that, sometimes there can be a level of resistance, whether individuals or programs or institutions. From your perspective, what do you think either could be driving it, or how can you work past that, or what strategies have you found effective in shifting those mindsets?
I don't know if I've been super successful. I'd have to think about that. But I think if people are resisting, what I've come to understand is, or what I've learned, is that they don't really understand what interprofessional education, collaborative practice is, and they don't understand the benefits. I truly believe that. And I think either if they're resisting actively, being very vocal about we don't have room in our curriculum, it's not necessary, or just even passively with that, maybe not even sort of that they care, or it's less of a priority. I do think it's just not truly understanding how it can be done. It doesn't have to be a course that's hived off and separate. There's ways to integrate some really meaningful experiences, across the curriculum, but it takes effort. And I know that people in post secondaries are stretched. There's less people working, more work. So it's not easy. Definitely it isn't easy, but I think if there can be, I know it's always a bit of a risk to say if there's a few champions, but if you can, bring together that coalition of the willing and the people who are really committed to it, you can make some really cool things happen. And, again, I think of Safe Stan, and I mean, it was a lot of work to pull those events together, as you know. But I mean, the impact was just phenomenal for learners as well as for the facilitators and the organizers.
Mhm.
So I think it's just persistence, to be honest with you, and keeping the conversations going. So if there are people who don't necessarily buy in, it's trying to understand their perspective and see if you can change some minds.
Yeah. I think that's a great approach. And also, it could be a great opportunity for continuous quality improvement, right? If they have some
Absolutely.
hesitations, maybe there's something that can be adapted or needs improvement, right?
Yeah, absolutely. I think it's great to hear like, well, what are their ideas? What have been their experiences? Because many of the people that we're working with have clinical experience. So what has their clinical experience been like? And you can bring that into the practice setting. And, maybe they didn't have positive interprofessional experiences in their own background.
Mhm.
That could be jading their perspective now. I think it's really trying to come to an understanding and just keep the conversation going. And I know one of my mentors, she said you always have to have room at the table for people like that, and
Mhm.
just keep that chair open, even if they don't come to the table right away. Hopefully, they will come at some point. And so I've always tried to sort of keep that in the back of my mind.
Yeah. I think that's great advice. I really feel like even since when I've started becoming involved in IPE, there has been continuous momentum building. So reflecting on when you first became involved, what do you think the landscape, has changed really, and how might you describe the current state of IPE?
I think that the evolution has been moving towards more that experience based. And so, whether that's simulation, which is always growing, always expanding, And I know there's some great work that you're doing at NATE with respect to that. That's always exciting to see. But I think really trying to find some meaningful opportunities within the practice setting. Um, and I mean, my belief is that there should be that continuum. So you can start in a classroom doing some basic things, learning some basic communication skills, but then threading that IPE throughout the curriculum, um, simulation into practice. And so I think that continually trying to find ways to integrate it into the practice setting and having the students learning with health professionals, because a lot of the health professionals still need to learn some of these skills. Um, I think that's just the way forward. We have to just keep the compass focused that way.
Yeah, definitely. I think there's that's a great point because I think there's many healthcare providers that didn't get the opportunity for IPE. Even, myself, I think there's plenty more people that are, much more experienced. So continuing that opportunity and including them, inviting them to the table is great. So I'm really interested to kind of shift gears and speak more about your research side of things. You've had quite a broad reach. Can you share where this work has taken you, both in terms of collaborations and its translation into real world practice?
I think that one of the things I've really enjoyed with the work that I've done is just the different people I've got to meet. And whether that's in Edmonton or across Canada or internationally, I'm, working with some people from University of Florida, University of Toronto, and we've become such good friends. Our Zoom calls now, we do primarily social conversation, and then we get into the work.
Yeah.
But I think it's just, my work. I'm not working directly with pre-licensure students as much as I have in the past. So I think more about the postgraduate or practicing professional, and their interprofessional opportunities. So there's been a little bit of a shift with the research that I've been doing, which I think is how it goes
Hmm.
in a career. And I think that there's just so many opportunities for research that it can sometimes be almost overwhelming where to start
Hmm.
even. And I do a lot more mentorship now with respect to research than I did early in my career. So that's something that I really enjoy as well.
I can see that being very rewarding and really helpful as someone who is still early stages into the research side of things. Can be intimidating,
Sure.
getting immersed in that. So it's always helpful. So I want to take a moment and recognize or acknowledge your recent recognition for the Al Rundio Memorial Award for Outstanding Publication.
Thank
Congratulations.
you very much. Team effort, of course.
Right. Well, as always, when it comes to IPE, can you tell us a little bit about your article, Getting Everyone on the Same Page, Assessing Interprofessional Competencies During Student Placements, and maybe some of the key insights from that work?
Sure. So this was when I was at the university in the Health Science Education Research Commons, and we were really trying to make significant and meaningful strides into practice education. And so, wanting to optimize the opportunity students had when they were on their clinical placements to have any sort of interprofessional education opportunities. And something we realized early on was that there didn't seem to be a shared understanding with the students, with the clinical coordinators who coordinate these placements on campus,
Mhm.
and the preceptors around the different knowledge and skills and attitudes that the students needed to have depending on what year of the program they were in. So were they in their first year? Were they second year? Were they about to graduate? Of course, the knowledge and skills is different at those different levels. But there wasn't really that baseline and a good understanding across those three groups. So that's kind of where we started, was to look at the Canadian Interprofessional Health Collaborative Competency Framework and really sort of tease it out into very detailed and specific actions that preceptors wanted to see their students perform and clinical coordinators wanted to see their students perform at different levels. And it was actually a great project to bring those three groups together and have some conversations um, around, yeah, what were the expectations? Because I don't think the expectations were always clear what
Mhm.
students needed to come away with from those experiences. So it was pretty detailed work, but like I say, it was a lot of fun and learned so much from the partners. And I mean, a huge thank you to the students and the clinical coordinators and the preceptors that were engaged in the process, because we couldn't have done the work without them. And just to hear their conversations, they really care about the learners and the students care about their education.
Mhm.
So that's always a really powerful thing to see, is that, oh, I think we can make some real impacts on healthcare through these types of learning experiences.
It's so nice to hear. I know everyone gets into healthcare because they want to help and they want to make a difference, right? But it's easy to get caught up in those like those pass fail components, and it has a big impact on their progression, right? So sounds like you did some very meaningful work in kind of drawing that out and talking about how to put that into action. I know it's a big conversation piece with many of the IPE colleagues that I connect with.
Absolutely.
So, you know, beyond the scheduling component of when clinical training happens for different programs, but when you do find some time together, what would be your recommendations to kind of focus their purpose on IPE in the clinical setting?
I mean, that is a good question. I think some of it might depend on context, obviously. Um, one of my thoughts is just around getting to know each other. So there's always that social aspect, which is really low stakes, but can have huge impact. Um,
Also kind of helps break the ice a little bit,
yeah,
right? So
it's a
they can have
starting
role
point.
clarity.
Yeah, and yeah, exactly. I was just going to say role clarity. Like, I think that's one that's it's sort of an obvious one to look at. But there's, um, just trying to communicate as clearly as you can and being transparent, and perspective taking is a big one. It's maybe not formally a CIHC competency, or maybe not formally in the framework, but I do think it's something that's really important with this work, with anything collaborative, is really trying to understand someone else's perspective,
Mhm.
and not always when it's going poorly or heated,
Yeah.
but just even in the times when things are going well, just trying to learn more about what they're thinking, and I think that can just go such a long way
Mhm.
to a positive collaborative practice experience.
Yeah.
But yeah, because I think, like, one thing we found with this research was that the clinical coordinators weren't necessarily clear around, I mean, competencies. Competency language is more in the post-secondary sector, right? And even we have
Mhm.
a hard time sometimes following and
Yeah.
understanding what it means. But the clinical core, or the preceptors, um, I think they had a hard time. Not everybody, but often it's really a hard time with that language and those concepts and those ideas. And so it's just trying to simplify that sometimes. And
Mhm.
there's a really great chapter written by Leslie Bainbridge and Glenn Regier called something. I can't remember the exact title, but basically there is an I in team,
Mhm.
and they've kind of boiled it down to social capital, perspective taking, um, negotiating priorities, and the conflict management. Conflict's always something to be addressed.
Mhm.
But they sort of removed that competency language and looked at those are skills that we should be sort of fostering in individuals, because it doesn't matter if you work in a good team or maybe a not so great team. If you have those skills, then you can go pretty far.
Mhm.
Yeah. So,
I can see, it's difficult when you think about like a healthcare provider. Sometimes those technical skills are very much specific on what success looks
sure.
like. So when you
Yeah,
put it down to communication and there's so many variables,
absolutely.
it is difficult to nail down what is
It's
the success.
I mean, we're putting students in very complex environments, and there's the human element, as you say.
Mhm.
Um, I mean, I just finished watching The Pit.
Yes, I'm sure we all are.
So yeah, it's complex what we're doing with our learners, and yeah, I just hope that I know curriculum is very full in all the programs, all the professional programs.
Mhm.
I think the demands are getting even more so. I just hope there's always going to be a role for interprofessional education. Um, and I think you have to keep attending to it so you don't lose it.
Mhm.
Yeah.
Yeah. Okay. So thinking about the research again, many of us are really immersed in facilitation or, leading courses, but maybe not, you know, delved into the research side of things. So for those people who might be just exploring getting into IPE research, what would be a practical first step that you could recommend?
I think maybe a mindset, first off, is to be curious. And that's where questions start to come in. And that's obviously what drives the research, our questions. But getting curious, talking to people in the field, talking to your colleagues, even going into the interprofessional literature. There's several journals that have some, that are really, really good journals. You can get into and kind of see, like, what's happening in the literature. Is my question being answered already, or do
Right.
I have an answer to it already in the literature? But if you find after a bit of a lit search that you can't find anything about it, and you're maybe not really sure where to start, if you do have some colleagues or even one colleague who does have a bit more experience with research, it's maybe sort of surrounding yourself with people who have a diverse set of skills compared to you, and working on something together collaboratively. I have always done my research in a collaborative setting, so that's just normal for me, to work with others on research and pull together different skill sets and different knowledge bases to move a project forward.
Mhm.
So I think if someone is curious about research, it's sort of finding that person close to them who, okay, who else is interested in this, and sort of gathering steam that way. And is there somebody in that circle of friends or circle of colleagues who does have some research experience that you can tap into?
Mhm. Yeah, definitely was helpful for me working with you as well as Ephraim Violato at NATE.
Absolutely.
He's a
Yeah.
fantastic resource.
Ephraim's a
So.
great resource. Like another suggestion is to the Masters of Education, Health Science Education program
Mhm.
that we run through the Faculty of Ed at U of A. You can develop some great initial research skills through a program like that, and as well have that support from professors and other instructors to help you with that work.
Yeah, maybe you can tell us a little bit about that. I went through, successfully completed that program as well. But from your side of things, what are some key outputs you see, like people being able to take that and, support their careers in education, maybe?
Yeah, absolutely. I think something that I really learned when we started that program, in the late 2000s, was that sense of imposter syndrome that many instructors have within health professions education.
Mhm.
People are put into roles not because they necessarily have an education background, it's because they're experts in their field. They're a health professional who maybe has an interest in education and move into that field. But what the program has done is really give some foundational skills And I mean, that's putting it mildly, probably, in how to be a real leader in education, and be seen as an expert in education, whether it's with assessment, um, writing learning outcomes, doing a program evaluation.
I found the tech
I was just gonna
support is a
mention,
huge
yeah.
piece, especially if you're a practicing clinician, not being, familiar with that for the most part. I'm sure we're all comfortable with Zoom by now, but um, those different learning strategies and technologies that can support that.
Yeah, I think what we really wanted to do with the program was ensure that we married sort of theory and educational theory with the practical piece so that when you learned something on the Thursday night in class, you could apply it right away, Monday morning when you were back in the classroom or back in your own teaching context. And I think that's the other thing I really like is that how we view learners, our learners we see work with pre-licensure students, or they work with patients and families, or they work with their peers in continuing education. So there's quite a continuum of learners that our learners work with.
Mhm.
And I think that's just so important in healthcare. I often think that health organizations can pay a bit of lip service to the importance of education. And I understand patient care is number one, that's the top priority, as it should be.
Mhm.
But I also feel that professional development for staff, for the health professionals, is critical as well. And a program like this, I think, can do that if you're interested in education.
Yeah. So, wanted to check in and see kind of what new things you have on the horizon. Do you have any research that you're thinking about or anything within the program that's really exciting right now?
Sure. Well, within the program, really starting to look more at the development of a professional identity around education. So, an educator identity. And what does that look like for our learners? How does that evolve over the 2.5, 3 years that people are in the program? We are also wanting to start a doctoral program for health professionals, again, who are maybe interested in that. And I can see that identity work continuing on into that because there is a shift in how you see your learners, how you see education in that educational context as you go through those different types of professional development yourself.
Hmm.
And then I have some work with colleagues that I mentioned before, and we're kind of exploring health system science and the interprofessional education intersection
Hmm.
because health system science has really taken off within the U.S. medical schools. That's kind of where it started, was within medicine there.
Hmm.
Um, and it's so similar in many ways to interprofessional education that it's just like, oh, we need to talk to each other, and we'll see if that conversation happens. But
Hmm.
yeah, so it's kind of interesting.
I can definitely see that continuing. As we look at the teams and how they come together, the system obviously has a huge part to play in that, right? So better
Absolutely.
understanding that makes a lot of sense.
Absolutely. And I think that from what I've read with health system science, they experience some of the same challenges that we do with IPE. The learners maybe don't understand why they're taking this content rather than physiology or pathology. And it's just trying to find space in the curriculum too. So rather than trying to compete against each other, then let's work together. Because again, so many similarities between the two,
Mhm.
in my opinion.
I would agree. I think that makes a lot of sense. Yeah. Yeah. Okay. Well, thanks so much for joining me today.
Well,
It's
thank
really
you, Lisa.
interesting to hear what you have going on and your knowledge and expertise in interprofessional education and research in the field is something that we all look forward to seeing what you have going on in the future. So
Thank you. Thanks for the invitation.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.